Hi everyone, welcome back to On the DL. I'm Dana Levinson and you're watching AskTheDoctor.com. Thanks so much for joining us today. We are talking about two hot topics. One is coronavirus and testing of COVID-19 antibodies. What test is accurate and what is not? What is out there? What's been floating around? There's been a lot of controversy and a lot of misinformation around the antibody testing. As well, we're going to be talking about ketamine and what it is and what it is used for. In just a moment, we will be joined with Dr. Bal Nandra, who will be talking to us about what ketamine is and what it is used for. I'm just waiting for Bal to join us in 1 second. Hold on, we're going to send that. Go, Dr. Nandra, I'm just waiting for you. Sorry about the confusion here on Instagram Live. It's always a different day when you're on live. Hi, Dr. Nandra. How are you?
Hi there. How are you doing today?
Thank you very much for joining us here at AskTheDoctor.com. I appreciate your time. I know you're a busy guy these days.
Absolutely. It's great to be here from Chicago.
So yeah, welcome from Chicago. You are the medical director of IV Solutions and the Ketamine Center. We want to talk about ketamine because ketamine is getting a lot of buzz in the medical world right now. We've been talking about depression and the effects of COVID and the aftermath of isolation and quarantine and what that has done to many people and their mental health, and particularly those who have been suffering from depression and how severe it can be and will be potentially after all of this is said and done. So I want to talk about ketamine in regards to depression, chronic pain syndrome. But first I want to talk about coronavirus antibody testing. And you being an anesthesiologist as well, I've heard you speak about this, that there is a lot of misinformation out there around antibody testing. So what do you think, first and foremost, is crucial for people to know? Sorry, Dr. Nandra, I've just lost you here. If you can't hear you, you're just freezing up a bit. We have lost Dr. Nandra. He is there. I know he's there, but he's frozen. And again, we were talking about, here you go. Okay, that's great. You were frozen before. Okay, so I was asking you about, there's been a lot of misinformation about antibody and antibody testing. So what do you think is the most important thing that people need to understand and know right now about this?
About ketamine?
No,
Or
we were talking about the coronavirus and COVID-19 antibody testing. So I wanted to talk about that topic first. So
sure.
I wanted you to give us your take on what you felt or you feel is, there's a lot of misinformation out there right now. What do you feel is really has been miscommunicated around the testing?
Well, I think one of the biggest issues is that we've seen a flooding of the market with a lot of tests for antibodies that just aren't accurate or poorly manufactured tests. And that all began in the spring and earlier this year, when in the United States, of course, the FDA kind of deregulated all these companies in order to get as many tests on the market as possible. So a lot of these companies that have put out antibody tests, these rapid tests, these little strips that we've seen, these tests were never validated by the FDA. In other words, the FDA didn't do their own studies on a batch of them to see how accurate they were, and if that accuracy actually matched the company's claims. So now, in the last couple, pardon? Go ahead.
How widespread are these tests? Are they everywhere? Are people using these tests widely right now?
They are. They actually are available everywhere. In fact, in Chicago, you can order like literally 10 different kinds of these things, and almost none of them are actually validated by the FDA. So everybody is out there kind of like to make a buck, you know. And a test really has to be independently tested by the FDA or CDC to confirm that it is that accurate, because especially when the prevalence of COVID isn't that high yet, the lower the prevalence, the lower the accuracy of these tests. So you need a test that's incredibly accurate to start detecting antibodies this early in the course of this disease and its prevalence across the country and the world.
And so what would be considered an accurate test? What is the ultimate test?
Well, so there's two primary aspects of a test, and that's called sensitivity and specificity. Okay, so specificity is a test ability to actually detect a true positive. In other words, your antibodies are there. Is that real? Okay, so
Mm-hmm.
that's a true positive. Sensitivity is its ability to detect a true negative. So what we want is high on both of those, and typically you want well above 95% or around 95% or higher on both of those aspects. But again, that has to be also validated by the FDA. Our clinic in Chicago, we've actually tried two two different companies for these tests, and neither of them were validated by the FDA, but we thought we'd give it a try. And they both delivered incredibly inconsistent results, even when those same patients actually went to a lab afterwards, or we actually had patients who had tested COVID positive,
Wow.
weeks earlier and went through the disease and everything, and they still tested negative for antibodies, and that's virtually impossible. So, so we literally were just, you know, basically just trying these on staff and people we knew just to see if they were accurate. And at the end of the day, we found out they were almost worthless.
That's a little bit
So
scary. That's a little
it's
scary.
actually really scary. So
It
really,
is.
the only true good option is to, go to a major lab, right? And actually have your blood drawn and have it done there, where they're actually doing doing it a lot differently, a
Mhm.
lot more sophisticated, and with different techniques. And that's probably where you're going to get more accuracy. But that also limits availability, right? I mean, it would be great to just be able to do these in your office or even in your home theoretically if it was validated. Now, about last week, literally about a week or so ago, the FDA did finally kind of put its foot down and say, okay, now these tests have to be validated, or we're going to try to get as many of them validated as we can. So, and give them what we call an EUA in this country. That's an emergency use authorization. But in order to do that, that test would have to go through the FDA's discretion and have its results double checked and all that kind of stuff. So,
What do you think it speaks to? Because for me, when I'm hearing this, it speaks to the idea that people are so desperate to find out if they've had it or they haven't had it, given that there's such a wide range of symptoms or no symptoms at all. And everybody wants to get back to life. They want to get back to work. They want to get back to their routine. And everybody's in this pause mode. So everyone seems to be really desperate to have a test to say, I have the antibodies or I don't, which means I'm still susceptible and vulnerable. So I feel it speaks to that. What do you feel it speaks to?
well, I think if you're that concerned, you really just have to make the effort to find a valid test or a good testing site that actually, uh, is endorsed by, a governmental agency or a testing agency. It's just I don't think it's really safe to go out there and get a positive test on one of these little things, these little strips that really look like a little pregnancy test strip, and then end up, not having antibodies when they said you did, and you kind of become careless, then you expose yourself, and then you get sick. So you really need to make sure you find a good source for testing, and that's really what it comes down to. And that's a
And
big problem. I mean, in the United States, we're still, still having a tough time just testing everybody or enough people.
mm-hmm.
In the last 24 hours, Chicago did 40,000 tests, which is the highest number we've done in 24 hours by a long shot. Typically, we're doing in the last few weeks about 10 to 15,000, and
It's
in
a
the
lot.
last 24 hours, we did 40 some thousand. So we're really in our state trying to Illinois, not Chicago, but Illinois. We're trying to really ramp up our testing because we know that that's ultimately what's going to let us get the data that we need to go back into society as we hopefully as it was before.
And so this is a good segue to your clinic and what you do day to day, which is your ketamine clinic. And so
Mhm.
you've been able to keep your clinic running.
We've been open throughout the pandemic, and we've just been incredibly careful. trying to, have a lot of social distancing, patient isolation. Obviously, we wear PPE in the clinic, myself, my staff, the nurses, everybody. We have never had people in the waiting room. You just go walk into the lobby and go straight to your treatment room. We wipe it down with, Cavicide and these medical grade cleansers wipe the room down between every patient. And patients have to wear masks also. And so we've done a good job, and we've actually, had no incidences over the past 8 weeks. So we've done well. And our clinic, mental illness, as you kind of alluded to in the beginning, is really on a rise right now. In early mid-March, towards the end of March, we definitely had a bit of a slowdown because I think that's when a lot of the lockdown started and people just didn't want to go anywhere, and that's fine. But in the last 2 or 3 weeks now, we've really been getting very busy, and a lot of them are just new patients and who have really struggled because COVID and the uncertainty and the isolation and all this stuff has really kind of exacerbated their depression, their anxiety, and a lot of people, it's actually causing PTSD. This is actually going to be a kind of a unique cause for PTSD, something like this that we've really never seen before. But it's going to be a big cause of PTSD for a lot of people.
Can you tell me a little bit about ketamine? It's getting a lot of buzz, so I want to talk about what is ketamine and really primarily what is it used for?
So ketamine is it's a drug that was actually developed in the 1960s here in the United States, and it was developed as an anesthetic drug, and it was FDA approved for anesthesia in 1970. It works with a completely different receptor system than any of these, SSRIs, the Zoloft, the Prozacs, all these drugs of the world. Completely different system in the brain. So that's what's kind of makes it a very novel treatment for depression and anxiety and a lot of other mental afflictions. It works with a receptor called the NMDA receptor, and the neurotransmitter, the signal chemical, is called glutamate. So by raising glutamate levels in the brain, it's able to rapidly relieve depression, and it's actually remarkable, Dana. We see patients after one single treatment, which is a 45-minute treatment, who've been suffering for 20, 30, 40 years, their whole lives, and tried, dozens of medications and you name it, and therapy and everything. And sometimes one treatment will completely transform them. It's just unbelievable. And then we usually do a series of 6 treatments over a course of a couple of weeks. Sorry, I touched my face. I'm not supposed to do that. But we do that over a course of over about 2 weeks, six treatments. And that just furthers the improvement and makes these changes stick. And so what's remarkable about ketamine is it also causes release of growth factors in our brains. And those growth factors, believe it or not, actually kind of stimulate the formation of like new nerve pathways in the brains and new nerve elements that grow like almost after the first treatment. This starts happening. And this is what, it's almost like you're healing the brain. Okay, so you're kind of rebooting the brain, healing the brain. We call it a lot of different things, but that's why these results and the improvement will last for weeks and sometimes for months after we stop the treatments completely. So the other remarkable thing about it is that you can be on ketamine and come in every month or 2 months for your booster treatments, have no symptoms for your depression that you had all your whole life, but you'll also have 0 side effects. So it's just remarkable because, as you know, all the SSRIs and all those drugs have really horrible side effects, and that's for young people, old people, doesn't really matter. Those side effects sometimes are worse than the disease, is what they tell us a lot.
100%.
So it's just remarkable, really is.
So and ketamine's also been used for chronic pain as well?
Yes. We've been using it for chronic pain for a number of years, and as an anesthesiologist, my clinic probably does more chronic pain than most clinics do too with ketamine. Obviously, still, mental illness is still 99% of what we do, but we still do a lot of chronic pain. Mm-hmm.
So what is the controversy around ketamine? Is there any controversy, or there is?
Well, the controversy. So we've been open for almost 4 years, 3.5 years. And when we opened back then, there was definitely more controversy because at that point, clinics were just kind of popping up. But there was a ton of studies. I mean, this is a drug that The initial discovery of its efficacy with depression came out of Yale University in the year 2000. So we're talking almost 20 years now of research on this. And the NIH did a lot of the research, NIMH, and all the big academic centers, Harvard, Yale, you name it. So we know that it works, and there were so many studies to support it, and the results are just astounding. That's kind of what pushed me into really trying to do this, because I just thought, my God, this is amazing. So the stigma was a little bit rougher back then in those early days. In the last, I would say, 2 years, I think it's been reduced vastly, and it's almost been about a year now since Spravato, the ketamine nasal spray, was FDA approved in the United States for use, and that pretty much eliminated the stigma completely. Because, whether it's IV or whether it's nasal, it's still ketamine. So Johnson & Johnson kind of did that, but we do know also that the IV ketamine is 2 or 3 times more effective than the nasal. So it works great, and we're lucky to have a drug like this that can work for a lot of people.
So there's a way to get ketamine through your nose. There's a nasal spray as opposed to an IV.
Yeah, in the U.S., there's a nasal spray that was FDA approved last March.
Wow.
Actually, no, actually it's been, a little over a year ago. And but you still have to do it in the doctor's office. So it's not something you can take home.
Okay.
The
Nasal spray, you think that you can take that home,
Yeah.
Yeah.
Yeah. When Johnson Johnson, when the FDA gave them their approval, that was one of their caveats, is that you have to go to a doctor's office to use it. You have to stay in the doctor's office for 2 hours for observation, the psychiatrist's office or wherever it is, and you have to be monitored and all this stuff. So it's not, even though it seems simple, there's still a big process involved around it. So most patients typically, and a lot of really prominent psychiatrists I know around Chicago at the universities and stuff, they prefer IV over nasal, just because A, it's more effective, and B, it's still more controlled as far as the dosing and stuff. It's much more predictable dosing and everything when you're giving something intravenously versus just spraying it in your nose. So
you were saying, just to go back on a topic, something that I want to touch upon, that you said that your clinic has remained open during the lockdown and isolation, and you've taken extraordinary measures to make sure that everybody stays safe. Do you see that and those measures going forward, that will be the new reality of, I guess, doctors' offices? Medical professionals will have to adhere to some kind of protocol where we don't have packed waiting rooms anymore.
Yeah, I think a lot of what we're seeing is going to be kind of becoming the new norm, as they say. In doctors' offices, a lot of practices I know, they're going to telemedicine, doing more and more of that. And frankly, I think a lot of practices, medical practices, like a lot of businesses, are finding out that this is a good way to do medicine. And obviously, that's what Ask the Doctor is kind of perched on, and that's what they're pushing. And it's a great foresight, because that is kind of the new norm. I mean, we're definitely going to have to screen patients closely for a long time until there's a vaccine. And that's, I mean, God only knows how long that's going to be. I mean, we have, I think Fauci today announced that there's 8 companies in the running for developing a vaccine. And, the best hope is that we have one by winter. That's the best hope. But I think more realistic is beyond that. And until that happens, and people say, oh, there's going to be a vaccine, then it's all over. But there are how many billions of people on Earth?
That's
I mean,
right.
you got to think about that, right? And vaccines are going to be prioritized. Healthcare workers, elderly people, susceptible people, sick people, immunocompromised people, they're going to get vaccines first. It only makes sense.
Absolutely. And then so it goes back to that question of testing. May I ask your opinion on something? It's a question that keeps coming up. The UFC fight, right? How accurate do you feel that testing was?
Probably not too accurate. I mean, it's hard. Again, I'm not sure exactly what kind of testing they did, but the RNA, the molecular testing, is really the gold standard
Right.
for detecting COVID. antibody testing again. Who knows what they use, if that's what they use? Who knows if chances are that wasn't accurate, because there's,
Right.
I think only one or two companies so far have been given that emergency use authorization for antibody testing. I believe it's a company called Celex.
Mm-hmm.
They have a little strip, like I mentioned, that's supposedly accurate enough for the FDA to give it a stamp of approval, but there's not been too many more. So, and it's, and you know, even those tests, they're out there, but you have to buy them in gigantic numbers, and so it's still not easy to get these things.
So, you know, again, this lends to my next question. We're talking about sports and testing. Uh, Many leagues, NHL, NBA, they want to get back to some form of competition. And so to do that, the players are going to have to be tested,
Yeah,
correct? Right.
absolutely.
So they have to be tested. And there's been some buzz that some of the teams will be back playing in the next couple of weeks. Do you see that even as a possibility? Not playing for competition, but
Yeah.
perhaps just playing in terms of practice. Is that
You know,
realistic?
it'll probably happen to some extent over the next few months, again, depending on things. I don't know if you heard about this, but Major League Baseball tested the entire league. And this is
Right.
actually probably one of the largest little studies we have on something like this, but the results just came out earlier this week. And I think they tested like somewhere between 5,000, 5,400, 5,500 total people, team players, managers, staff, coaches, you know, even the people who work in the stadiums across all these sports teams, the Major League Baseball teams around the country. And it was antibody testing, by the way. And although I'm not sure exactly what test they used, I'm assuming they used an accurate test since it's Major League Baseball. But what was remarkable about that test, what percentage do you think of those 5,500 people that were tested, do you think tested positive for antibodies? In
You're
other words,
asking me
they're
what?
theoretically immune or have been exposed to the disease before. Take a guess.
Mm,
5,500 people, all over the country, all demographics, all races. Pretty diverse group, really, when you think about it.
50%? No.
Not even close. Less than 1%. Yeah,
What?
like 650 people or 40 some people out of 5,000. So which is really kind of sombering and kind of depressing actually to think about it, because that just goes to show you that we have a long ways to go. We're not even close to herd immunity yet, and wow. Now they're obviously looking at that it's still undergoing peer review, of course, because all studies have to do that theoretically again to be considered valid. So hopefully, you know, we'll learn more, but you know, preliminarily a 1% number is pretty low, very low,
So,
less than 1%.
I mean, I don't want to be a buzzkill, but this sounds, it doesn't sound very promising in regards to let's get going on this. It sounds like we
Yeah,
still have quite a ways to go. We have to be patient and we need to wait this out until that test has really been perfected and accurate, right? We have to wait because, like I
yeah.
said, people want so badly to know if they are walking around with antibodies. Have they had COVID or not,
Have they
right?
had COVID? Exactly. It,
Do they
re-
have?
it really seems like right now all we have that's really accurate is the ability to just detect current disease, right, with the
Right.
RNA molecular test.
Mm-hmm.
And what happens with COVID is there's two antibodies that develop. Okay, so on day zero you get infected. That's the day you get infected is day zero. Okay, around day number 7 or 8 or 9 after you're infected, that's when the IgM antibody starts rising up. Okay, so IgM goes up first, and as your disease worsens and you get symptoms and everything, and it's around day 12 or 14 when you kind of your disease kind of peaks and your viral counts peak, and then you start recovering from days 14 to 28. But it's right around day 12 or 14 when the IgG antibody, and that's the one that confers immunity, we think, that's when that one starts increasing. So you can't even detect the IgG until about 14 days out, and then the IgM, the first antibody, will drop around at about the same rate as your symptoms go away. Okay, so your symptoms go away by day 25, 28 into this cycle, and but your IgG is still going up. So, and then it stays up theoretically and gives you immunity against future infection. But that's the other thing we don't know. We don't think that you can get reinfected, but there's been some anecdotal cases of that, which a few weeks ago they refuted, saying that those were probably inaccurate tests and that's why they were reinfected. So we don't think you can get reinfected, even if you have antibodies. But you know, I guess the virus can always mutate, and there's words of that happening. There's thought of that happening now, but which would mean a different set of antibodies and a different set of everything. So it's there's just really so much to learn, and
Yeah.
we're still learning because you
Right.
know we've really never experienced something on such a large scale that's got this very bizarre range of symptoms and presentations. I mean, you know, initially it was fevers and cough and
Mhm.
shortness of breath, and now it's GI symptoms and diarrhea and headaches and the loss of sense of smell and taste is a really actually accurate symptom, and that can last. I know people who that's lasted for even 3, 4, 5 weeks after they're feeling okay, feeling well.
Wow.
And the other symptom that seems to really make people miserable and is the weakness and the shortness of breath. Uh, Actually, a family member of mine had COVID, and he was a young, healthy kid, and you know, very athletic, working out, all kinds of stuff in his 30s. And you know, he recovered. He did fine. He recovered, but you know, even 2, 3 weeks afterwards, he says, you know, I went out to throw a tennis ball against a garage door, and I did that for like 10 minutes, and I was exhausted and short of breath for 4 hours.
Yeah, we're
So
going to
it
skip
really
that.
takes a toll on your body, even if you don't have to go to the hospital. It really takes a toll on your body, and you know it can cause some long-term uh, uh, damage in your lungs, and just that's why we get this shortness of breath. And
We
uh,
have a viewer or follower here who just said it's been 7 weeks for him. Seven
seven
weeks.
weeks,
7 weeks.
wow,
Yeah.
yeah,
So we know that everybody is different and it presents really differently in everybody. And if anything, this conversation has proved even more that we need to be patient until we get things right. And one of those things, of course, is the antibody test. Um, the other issue, of course, is the prevalence of depression and PTSD after all of this is over, which we just talked about. I'm grateful that you're so open about it because I've wanted to talk about the mental health effects and the aftermath of this
yeah,
for a while because as a mom of 5 kids, I'm starting to see it weighing very heavy on children and youth. Um, we haven't started talking about that yet either. I don't know if you use ketamine for kids.
absolutely. I've treated kids as you know. I treat most. uh, I've a lot of experience with treating kids actually. So I treated children as young as 12.
Wow.
12 is probably 12, 13 years old kids all the time. A lot of teenagers and adolescents, you know, and all the way up to people in their 80s. So ketamine has been proven safe for almost all age groups. You have to have a good clinician doing it, obviously. An
Mhm.
anesthesiologist is ideal because it's a drug that can have a lot of effects on your heart and your blood pressure and your pulse, as well as obviously your brain and how you feel and all this stuff. So there's a lot involved with it, uh, and that's all chalked up to experience, you know. But kids actually do really well with ketamine, and that's because their brains have more what we call neuroplasticity. So their brains are going to change when those growth factors start being released. The ketamine causes. Uh, their brains are more likely to change in a positive way. So,
Great.
so not only do they respond well to ketamine, they respond quickly, but the effects tend to last longer. We've seen. So it's really remarkable. And for suicidal ideation, which is obviously going to be a big problem and always has been, that's one of the first things that ketamine will just eliminate. It's remarkable. Typically, one treatment will reduce suicidal ideation to almost nothing.
Wow.
So it actually is a really good drug, and some of the more sophisticated emergency rooms, and emergency room doctors are actually using it for that now, in the emergency room, versus putting somebody on a hold and locking them up and all this terrible stuff in psych hospitals. Ketamine can at least get them in a safe place, and those effects can last for a few days, just one treatment. So it's really remarkable for suicidal ideation.
So before we wrap up, any last thoughts about what's happening in the world right now? I know you're in Chicago, I'm in Toronto, yet I feel like we're all living this alternate reality right now, and it's continuing at least for the next little while. Anything you want to say to that?
I think people have to remain positive and be very patient. I mean, it's devastating. Okay, I mean, it's hard to tell people, sit still and deal with it. It'll be over soon because, in the U.S., over 30 million people have lost their jobs. Almost 40 million people now in the U.S., which is over 10% of our population, that's in a month or month and a half. I mean, that's insane.
Devastating.
So I mean, how do you comfort somebody who's lost their job? And for a lot of these people, in the restaurant industry and certain industries, it doesn't matter what it is, there might never be a job again because a lot of these businesses are shuttered for good. Restaurants want to reopen and come back, but when they come back and when they reopen, they're going to reopen at 30 to 50% capacity because of the social distancing and all the new guidelines. I mean, who goes to a restaurant or a bar to be, 8 feet away from everybody and to not be social, right? I mean, that's the whole idea. And when restaurants open and the waiters are wearing masks and they're using paper plates and disposable dinnerware, I mean, that's why we go to restaurants. That's why we do those things. So,
do you see it that way?
Yeah, so there's going to be a second wave of unemployment. There's going to be a second wave of losses because when these businesses reopen in a few months, they're going to be like, well, I can't generate enough business because I can only have 30 people in here when I used to have 60 in here.
Yeah.
So there's a lot of downstream effects.
One industry.
What's that?
That's just one industry, right?
That's just one industry.
That's just one industry.
One industry.
Mm-hmm.
So, I think people, and this whole life versus economy argument is, I mean, it's not an easy argument. It would make sense just to say it's all about life, but at the same time, a lot of people's lives is based on their financial stability. So
I agree with you. I agree with you 100%. I think, Canadians are very politically correct, and we tend to not speak too much when we have a platform to do so. Some of us do, most of us do not. And to say something like, how many people have actually died versus how many people have lost their jobs, and what is life going to be like after these extreme measures, is a very touchy subject. I'll tell you, it's very touchy, but everybody has something to say about it, whether they positive, whether they know somebody who's had COVID, whether they've had COVID themselves. Everybody has an opinion as to what should happen next and what is going to happen next. So it's very interesting hearing that coming from a medical professional. You're getting thumbs up from people because the
lockdown is all based. I mean, to me, one of the most important aspects of the lockdown is to make sure that, if there is a gigantic surge, that our healthcare system can absorb it. And I mean, doctors and nurses typically never think about, okay, I might die in the job today, or I might catch something at work that's going to kill me. That's not really a thing. I mean, we take risks and we're of course exposed to things, but this is a novel thing because now you're being bombarded by this virus. I mean, I have doctors who I know who work, a lot more in hospitals than I do, and I mean, their stress levels are through the roof. I mean, it's impossible to not be exposed to the virus when that's all you're doing is dealing with these patients day in and day out. And so, the whole idea of this is just think about it. Chicago, for example, we're averaging 2,000-ish to plus cases every day, okay, for the last 6 weeks. Being hospitalized, 150, oh, sorry, and about 100, 150 deaths a day too. So, I mean, and that's what, like, literally, it's dead out there. I mean, I live downtown, that's downtown right outside my window, and that's with like 96, 95% of the people indoors. So just imagine 2,000 cases a day with everybody indoors. Just imagine what would happen if you let all these people out at once, how many deaths there would be every day, how many hospitalizations. I mean, the system would collapse, you know.
Right.
And that's the other thing I don't think people understand is that's one of the big reasons we've done these lockdowns and shelter in place orders is to preserve those resources.
Right. And
so that we can deal with it, because there is going to be a second wave when we reopen. There's be a second wave. There's no doubt about it.
Yeah, we know that.
So,
and we have to, and we're trying to mitigate the risk of a complete and utter breakdown and collapse of our healthcare system, right?
Yeah,
that's what we're really trying to do. And we just have to be patient. We have to be patient and just see what happens.
Be patient, be positive, and just
where can people find you? Because you're getting a lot of love on the side here from people and thumbs up, and I know people.
Well, we're in Chicago. Our website is www.ketaminechicago.com. That's KETAMINE Chicago.com, and our phone number, if anybody wants, is 844-948-6337. But come to our website. There's a ton of information on our website about what we do, and we're lucky to be able to help people, and it's the most rewarding thing I've ever done in my life.
I really appreciate you speaking with me for so long. I could talk to you for hours. You're incredibly insightful, and no doubt brilliant. And for sure, I could sit and just talk to you for hours and hours. But I'm going to let you go because I know you're very busy.
Absolutely, I'm happy to come on again.
Yeah,
we'll do it again.
And you know what? Why don't we touch base in like a month from now, let's say, and see how things are going in Chicago. I'll tell you how they're going here in Toronto. We'll compare. And
I have family in Toronto, and not only that, but I grew up in Canada. So I grew up in Saskatchewan, in Saskatchewan, about 100 miles from Saskatoon. So Canada's my old stomping grounds.
So you were Canadian.
Pardon?
So you're Canadian. You were born in Canada?
I was Canadian, absolutely. I'm a U.S. citizen now, but yeah.
Right. Yeah. Let's just make that clear, right? You just want.
Well, it's not always a positive thing. Don't get me wrong, but these days. Exactly. These days, I like to. I could single Canada pretty well. I'd be pretty proud of it. So
yes, I hear you. I would feel the same way if I was in your shoes.
Yeah,
that's a whole other conversation too.
That's a whole other conversation.
Thank you so much for speaking with me.
Thank you, Dana.
Be healthy, and good luck with everything. And we will be in touch very soon.
Absolutely, we'll be in touch. Take care. Bye bye.
Be well. Thank you. Thanks, everybody.
Thank you.